journey of the Union Zimbabwe office takes us to the end of 2000s, 2008, 2009, when this country office was set up as a result of a well-functioning pilot to develop an approach to collaborative TB-HIV services.
The Union has been in the country for the past 10 years, so we are actually celebrating our 10th year in the country. And we have been recipients of USAID grants since we started, from TB Cap to TB Care 1. Currently, we are actually running our Challenge TB grant, and this is our 5th and final year of running the Challenge TB grant.
With this mechanism, which was being implemented through the Union and the World Health Organization country office, we have actually made tremendous strides towards the fight against TB. When we started in 2014, our TB burden was almost 300 per 100,000, and currently we have seen that our burden has now declined by almost a third to 200 per 100,000.
We were looking at finding our missing TB patients in the country as a strategic focus area. We were also focusing on TB and HIV integrated service as our second strategic focus. Programmatic management of drug-resistant TB was our third focus. We're also focusing on issues on monitoring and evaluation, operations research as our fourth pillar in terms of strategy. We capacitated the National TB Program staff at all levels in terms of training and in terms of tackling the problem of TB.
We have managed to develop a number of key strategic documents for the country through the support. We have the National Strategic Plan for TB, which was actually also the basis for our submission to the Global Fund to get additional resources for the country.
We are also very, very proud of, in terms of what Challenge TB has done in the country. You can see the level of political commitment.
Parliamentarians were engaged, and also senior government officials were engaged. Quite a number of them have signed the Barcelona Declaration, which is the very high level political commitment globally for leaders to commit to ending TB.
We have worked with the Challenge TB for a long time now. One of the benefits that the Parliament got is that in the first Parliament, which was the 8th Parliament, we had capacitated members of Parliament, and we had done a lot of community engagements. It assisted us to communicate with communities through the Zimbabwe International Trade Fair. But most importantly, members of Parliament were able, because they were now capacitated to talk about TB in their constituency development meetings. And even the launch of the 8th Parliament Global Caucus, Country Caucus, was actually funded by Challenge TB. It was a next impossible mission without that.
We have a challenge of childhood TB, which we feel we are not doing enough. And with Challenge TB, we have managed to conduct a childhood TB situational analysis, which pointed to the issues which constrain children getting our services.
Childhood TB has been an area of priority focus for the project, and over the years, Challenge TB has supported an intervention package to strengthen childhood TB case finding. And it started in Makoni, where we piloted an intervention package with good results. We then rolled this package to 21 law notifying priority districts. We've seen an increase in the proportion of childhood TB cases notified in at least 12 of these districts.
Ndakaenda ku TB unit. TB unit kuyako vakanipa samba yacho iba ndaenda ku X-ray. Ndaenda ku X-ray kuya ndakatoka X-ray zvakanaka naka. Mwana atora X-ray yake. Atorwa X-ray yake kudero. Chimatamirira chiremba. Chiremba chizouya ashongorora ne-X-ray yayi. Zvikanzi ano mwana ane TB uyu. Mwana akatanga kumwa mushonga yacho uri musi wawo 1 November. Saka mwana akapedza mwedzi mitanhatu achimwa mapirisi eTB. ndokuzodzokera naye paclinic vachibva vamuongorora tikanzi iya zvaita izvi ndobva vakuloza vanyora dheti racho nokuti tatomudhisira kuti apedza kunwa giki rake. Kubva ipapapo mwana haana kuzofemburuka zvaanga achiita. Aiwa, kusvikira pari nhasi pandiri kutotaura izvozvi haasi kufemeruka.
We have made immense achievements, particularly on the activities and services which aim to reduce the HIV burden among persons with either presumptive or diagnosed tuberculosis. And at the moment, practically every TB patient knows their HIV status. It's also very, very rewarding to notice that over the last 10 years or so, the HIV prevalence among this high-risk group has declined from figures over 70%, and I think in 2018 we were at 62% as a country. As other comorbidities and other risk factors for tuberculosis are identified, we can build, for example, diabetes tuberculosis care based on the lessons we have learned regarding TB-HIV collaboration.
So I think diabetes TB is an important association, recently recognized in the last 10 years, and hopefully we can begin to deal with it better.
We are grateful to Challenge TB for the assistance they've given us to integrate TB, HIV and DMK through capacity building, providing screening consumables. Now we're able to screen TB patients for diabetes and diabetes patients for TB, all under one roof.
Ngahambe ekliniki ngingelamandla njalo futhi ngandihamba masinya ekliniki bafika bandihlola. Ekundihloleni kwami ngatholakala ukuthi ngile-diabetes. I-diabetes ngayibanjwa ngo-October. Ngithe ukubanjweni kwami i-diabetes ngakhontinya ngamaphilisi ami i-diabetes. Ngabela njalo ekliniki ngabatshela ukuthi lokhu ngicikilizeka njalo engangikuzwa kuphelanga. Then ngabatshela ukuthi sengikhwehlela njalo. Basibenginika amaloxane okufaka izikhwehlela. Ekufakweni kwami izikhwehlela, ama-results abuye esithi mina sengile njani. Isikhwehlela sami sile-TB. I-TB ngayibanjwa ngoNovember. Uthe sokunjalo nganathi treatment yami ye-TB le-diabetes kwaqhubeka kunjalo kodwa bengingasezwa lutho senginjani sengi-right.
Challenge TB also supported the rollout of newer tools for diagnosis of drug-resistant forms of TB. And as we speak, the country in all districts has at least one gene expert machine. Challenge TB has also supported the training of healthcare providers on the management of drug-resistant forms of TB, which has seen the rollout of newer regimens and the diagnosis of over 2,000 patients over the past 5 years.
The Challenge TB also supported us to strengthen laboratory systems in the country.
We were not able to give results for our molecular techniques, so they assisted in renovating our laboratory for us to be able to provide that technique. They also bought a twin incubator, which is used to do that technique as well. So our service delivery to our patients has been improved. Our DRA patients are getting their second-line drug susceptibility test results in time. The major thing that they also did was they discovered that our laboratory does not meet the International Biosafety Level 3 conditions. So they opted to buy for us a containerized laboratory, which is going to assist us in having the Biosafety Level 3 measures met.
We also supported a dedicated specimen transport system where we were moving specimens from peripheral clinics to the nearest laboratory. Over the lifespan of Challenge TB, over 1 million specimens were transported through the system, contributing to the diagnosis of close to 50,000 TB patients. Notably, 80% of these specimens were non-TB specimens, contributing to the overall strengthening of the health system.
Within this process of sample collection, we have noticed that we've helped a lot of people within the communities by collecting their samples to the labs, of which most of them were not able to ferry their samples to the hospital, and also taking their results to the clinics.
Contact investigation is one of the approaches the country has adopted to find more TB patients. The approach involves a screening of contacts of index clients that have been diagnosed with TB. In Zimbabwe, contact investigation has traditionally been the role of environmental health technicians. Through Challenge TB, our healthcare workers were provided with enablers such as fuel and airtime to facilitate contact investigation. In the last 5 years of Challenge TB, more than 11,000 contacts were screened for TB, leading to the diagnosis of more than 300 clients with TB who were linked to care.
Isifo lesinkosi ngibona ngathi wasithatha kimi ngoba mina ngeke ngagula 2014 iTB kanti lo sisi wami onguye ayehlala naye wayegulile 3 times default. Unkosikazi uqala ukugula isifo sofuba ngo-2014 walashwa yaphela yamphinda futhi early this year. TB yakhe akuseyiyo le fana lale ejwayelekileyo, isi-resistant to amaphilisi akhe, so isikhathi wavalela amaphilisi ngo-August. Since eqaleleyo treatment okwamanje ngibona ngathi usetshintshile ngoba usekwanisa ukuthi abambe ezinye zezinto laye azincedise. Ube lwana umuntu vele osehlala ngathi uyacabanga kakhulu. But now nge-counseling ayitholayo kumanensi e-Homestead lasemaphisa ngibona uselotshintsho kakhulu.
In the early years of Challenge TB, the country noted that we were missing a third of our TB patients within our routine delivery system. Through Challenge TB, with core funding from Global Fund, the country rolled out an innovative approach for finding TB among high-risk communities. We used trucks equipped with digital X-ray equipment and a laboratory for on-site diagnosis of TB. Target groups included people living with HIV, children, the elderly, artisanal miners, smokers, and diabetic patients.
Through the targeted screening program, we have managed to visit communities with high TB burden, offering services such as TB screening, HIV testing, and diabetes screening and testing under one roof. The communities have responded well. We saw it through the number of people that turned to our screening camps, and through this screening program we've managed to diagnose and link to care quite a number of patients.
Saka ndoshanda pa-Reading Main. Pandaka svika kuHowe ndakaona mota yanga iripo yemoto. Ndabvunza mwangu kuti seifamba aibva kubvunza kuti pari kuteswa kune vanhu vechi vane TB. Ndikati ndombotestwa. Ndapinda mota ndadini ndatestwa. Ndatestwa paipa zvikati une TB. Zvikati izvozvi TB yawo inayo chibva waenda kuReading Main clinic yedu yeReading. Ndikati hazvina kushata. Ndasvika wabva andipa macourses aya. Ndatanga kudini kurapwa paipa nanhasi mwiri wangu uchiri nani.
One major achievement that we have also attained is strengthening the use of data for action. As a country, we are one of the pioneers in the whole world where we have come up with a way of looking at our data, our routinely generated data. Then we capacitate the healthcare workers to analyze that data, and then they will be able to make management decisions which is based on evidence which they've generated themselves.
Before the training, we just used to submit figures, but we never really understood what the information was really about. We only thought maybe if we had high figures, then maybe we are doing a lot of work.
After receiving training on making sense of TB data, what we learned most on was on TB cascades, where we learned about presumption, how to identify the cases, how many samples are sent to the lab, and all of the samples that are sent to the lab, how many will back to the center. And this has actually helped us now in coming up with the specimen tracking system. We are saying if samples are not, if all the samples are not back at the health center, then we need now to identify where the problem is. Is it with the laboratory or is it with the health center? So nowadays we can actually interrogate our data using the same tracking system.
We have seen more presumptive TB patients being found. Our TB diagnostic cascades have been improved regarding the losses of persons who transition, for example, from specimen collection to specimen examination in the laboratories, and the laboratories actually sending the sputum test results back to the clinicians, who are then tasked with starting the patients diagnosed with TB on appropriate treatment.
We initiated conducting operational research courses in Zimbabwe targeted at building capacity in health workers, on developing research questions and research projects around challenges identified in TB and HIV programs.
It's not just about publishing papers. We do this work in order to collect evidence to change policy and practice in this country. And I think we've got a lot of examples where things are not going as well as they should be going. Those problems have been identified. I think solutions have been proposed, and one would hope then that improvements take place on the ground.
In terms of programming for other key activities, we have managed to conduct a TB patient cost survey, which is one of the key indicators that countries are measured on under the WHO and TB strategy.
The survey assisted us to identify the main cost drivers among these patients and their families, and this will assist us in policy dialogue, which is currently ongoing, to see how we can help eliminate this cost.
We have also managed to conduct a knowledge attitude practice survey, which allows us to have better information on what are the issues behind patients getting treatment, what are the issues which contribute to delays in getting treatment, and what are the issues which lead to patients not completing treatment as expected.
The CAP survey that we supported in the early years of the project revealed some critical gaps in the way messages were being packaged on TB and HIV. Findings from this survey informed how we then engaged media practitioners to improve the way they report on TB and HIV. We also supported radio programs to disseminate information on TB and HIV, and most importantly, created demand for quality services. We also worked with our community leaders to empower them to promote positive health-seeking behavior for TB and HIV. We are happy to say that as a country we now have a pool of trained health journalists and community leaders who are empowered to champion TB and sustain community awareness.
TB used to be a hard sell. Stories were just being written from the desk without those human interest stories. But with the coming challenge TB, human interest stories are easy to sell than just hard news stories. So Challenge TB gave us that exposure to get those human interest stories. So basically, coverage on TB increased, given that there is so much stigma surrounding tuberculosis. Together with myths and misconception, some of those stories managed to at least give people adequate information.
I am quite happy to say this grant has been a game changer in the country.
Thank you to Challenge TB for your contribution.